Good morning, Dr. Zheng, Dr. Falk, Chair, Hong Kong Breast Cancer Foundation, Dr. Chi, Head, Non-Communicable Disease Branch, Department of Health, Ms. Lau, Chief Manager, District Health Center, Primary Healthcare Commission, distinguished guests from Macau coming this morning, Dr. Wong, Head, Department of Community Health Care, Health Bureau, Dr. Cho, Dr. Hui, and Ms. Leung. Ladies and gentlemen, good morning. It is my great pleasure to welcome you to the 12th Annual Scientific Meeting of the Hong Kong Breast Cancer Foundation. On behalf of the Jockey Club School of Public Health and Primary Care at the Chinese University of Hong Kong, we are proud to co-organize this important event alongside the Hong Kong Breast Cancer Foundation and the Dong Hwa College, with the support of nearly 24 invaluable partners today. This meeting enduring theme, From Trial to Clinical Practice, reflects our shared commitment to translating research into real-world practice. Over the next 2 days, we'll hear from leading experts across the region on topics ranging from local and regional screening strategies to precision prevention and emerging treatment modalities. At our school, we take pride in being the first academic institution in Hong Kong to integrate public health and primary care under one roof. So we have epidemiologists, evidence-based medicine experts, but working with primary care doctors together to translate many of the research evidence into clinical practice. This distinctive model enables us to address breast cancer, and through describing the epidemiology and research evidence for preventive approaches to reduce incidence and mortality, but also through translating these evidence into practice and public health actions. It is this integration that empowers us to contribute meaningfully to screening programs, risk assessment models, and health system innovation that are both evidence-based and patient-centered. We are also very encouraged by the government's recent announcement of Phase 2 breast cancer screening pilot program, which expands coverage to a broader group of high-risk women aged 35 to 74, and this important development in collaboration with NGOs marks a significant step forward in early detection and prevention. We commend the Hong Kong Breast Cancer Foundation over many years for its pivotal role in championing this initiative and for its unwavering leadership in shaping public health policy and empowering women across our city. In fact, breast cancer screening is dear to my heart. Over the last 7 years, I have one family member and 2 colleagues who were detected with breast cancer through screening programs. So at that time, I still remember when my sister was going for the screening program. When she asked me, I said, there's not enough evidence to go for screening. And I thought, that would not be useful. Only 2 weeks after that, she came back to say that in the screening that she has conducted, that there is some problem, that she was worried. And I was just dismissing her concern at that time, still saying that from the population evidence, seems Hong Kong doesn't have that. And I felt guilty afterwards because 2 weeks after that, she was diagnosed with first-stage breast cancer. And then I witnessed the suffering, the concern over the coming few months to now about 7 years that she went through with the screening, with the treatments and also the intervention as a mother who needs to look after her children. So to me, now I have changed since this incident, and since then, I have 2 more colleagues over the past 7 years who have been diagnosed with early-stage breast cancer. Both of them got treated very well because it was diagnosed early. So I believe we should advocate for better screening strategies, which are personalized, that can take into account various factors into better screening strategies, and we should not just dismiss by saying the population evidence is not there yet. So I really congratulate the great work by Professor Dr. Polly Zhang and the Breast Cancer Foundation for advocating for changes and for better improvement in our screening strategies and gathering all these world-class speakers today such that we can think about better strategies in the coming future, such that in the future, women do not need to be so concerned about the risk, and they can be detected early with a treatment that can cure the breast cancer. So I believe these 2-day meetings will bring together regional expertise, and we will explore advances in breast cancer screening, risk prediction, and personalized care. And highlights the innovation in imaging such that we can have a policy suggestion in doing personalized screening in the near future. I encourage you, all of you, to take full advantage of this rich discussion ahead, and I'm sure I will learn a lot also from these 2 days workshop. Thank you very much.